Hey guys, Dr. Seamus here. I'm going to be talking about a condition that affects just quite a few patients I see come in quite often. And this is something that can really provide a major inconvenience in many ways and can hamper proper quality of life. And that is frequent urination. So we're going to be talking about some of the major underlying causes and then what we can do about that to help eradicate this problem. And so starting off with some of the top non-disease underlying causes, we have things like increased volume of fluid intake. So just drinking a lot of fluids throughout the day, especially things like caffeine, coffee, and tea can factor into this, being diuretics, increasing urinary output. And then as well as pregnancy can be a factor as well, just the growing uterus putting pressure on the bladder. And then even things just like a nervous tension and anxiety as well can contribute here too. So we'll switch into more of the disease-based processes here. And so the first one I'll mention is just a prostatitis or a prostate issue, or even a BPH, benign prostatic hyperplasia or hypertrophy, where just the size of the prostate can increase, and that can put pressure on the urethra and stimulate more bladder contractions. That can be a cause. Overactive bladder, urinary tract infections can definitely be can cause increased urinary output. Nerve damage, and we see this sometimes with stroke victims where there's just an improper functionality of the nerve at that point. Diabetes, and the reason for this is that the body tries to rid the body of excessive glucose to help promote better insulin sensitivity, and so getting rid of that glucose through the urine can cause increased urinary output. And then different diuretics and medications can help can cause frequent urination as well. Kidney stones can play a role into this, as well as bladder infection itself. And so when it comes to some of the things we can do pertaining to this, I would start off by just saying really watching the amount of especially just caffeine intake. Now, when it comes to fluids, we need to make sure we are staying adequately hydrated, but we don't want to overdo it. And then especially with caffeine, coffee, tea, and alcohol and stuff like that, we want to make sure we're not overdoing it there. That's going to help stimulate more urinary output. So we want to have good balance there. And then before bedtime, I would not recommend drinking fluids. This can contribute to anocturia, just getting up through the night. This can throw off circadian rhythm and even sleep cycles, and just affects sleep and everything, that all the benefits that come with proper uninterrupted sleep. And then there's something called bladder retraining as well. And what this has to do with is just being able to, over time, space out the intervals at which we urinate. So for instance, if someone gets up and then at like 10 a.m. they have to pee, and they have to pee again at 10:20, this bladder retraining would say try to wait about 10 minutes until about 10:30. And this can help retrain the bladder. And because oftentimes with this, the bladder's not completely full, but you're getting the urge to go. And so this retraining can help with this whole process. And then in addition to that, there are pelvic floor exercises and different Kegel exercises that can be administered to help strengthen the muscles around the bladder and the urethra. And this can help exert better bladder control. And so these are just a few of the main things I recommend when it comes to overactive bladder, just frequent urination. And if there are still issues going on here, this is a time when it may be good to look more internally, perhaps get some imaging or even order some lab work to maybe address more of the disease-based things going on or some of the infections that may be present. And this can give more insight as to how to treat that accurately. So guys, this is just something I wanted to address today, a condition that is very common, affects a lot of people. And I think if some of these steps are able to be implemented, we're going to notice major changes, major positive changes, where a lot of these symptoms can be eradicated and we don't have to deal with as much urinary frequency on a day-to-day basis. So guys, thank you for watching this video. Hope you found this insightful, and we will see you soon.